So let's discuss the clinical anatomy of clavicle. This is important for MCQ and Viva purpose. Okay, so first thing which you need to know is the fracture of clavicle. The fracture of clavicle happens when a person is falling on a outstretched hand. See, you can look here. This person is falling on the outstretched hand, and it is leading to the fracture of clavicle. Now, this fracture happens at what location? Where the lateral one-third and medial two-third end of the clavicle meet. At this point, the clavicle is weakest. So that's why the fracture most commonly happens at the junction of the lateral one-third and medial two-third. Okay, so now after the fracture happens, the trapezius muscle alone cannot support the clavicle. It cannot pull the clavicle upward by itself. So due to the weight of our limb, the clavicle, the lateral end of the clavicle will be pulled downwards. Okay. Second clinical point which you need to know is cleidocranial dystosis. You can see in this image the person has drooping shoulders. The person is drooping shoulders, and the person can bring the shoulders in front of their chest. The shoulders can be approximated anteriorly. So why does this happen? Due to a partial development of clavicle. The clavicle is not fully developed in this person. Okay. And sometimes what can happen, the clavicle can be totally absent, congenital absence of clavicle. So this was all which you needed to know about the clinical anatomy of clavicle. Thank you.